If you have a fire of energy that's getting you through your day, and that fire is literally burnt out and it's not there, you can no longer get through your day. So if you think about the difference between burnout and stress, stress would be, well, the fire's there. Is some wind might be blowing at it, it might be wiggling and all that, but it's still getting some heat out there. It's still giving you energy. You're still able to get through your day to day. There might be something that happens, a bill that needs to get paid unexpectedly, but you get through it. It stresses you for a little bit, but you get through it. True full burnout, that fire's not there, like I said. You don't have the energy to do certain things. Things are different now.
I put together a 5-day reset to a healthier you. This is a short challenge to prioritize your health and well being. So, if you're feeling up to the challenge, I want you to take a peek in the show notes for this episode, and you're going to see a link that says the 5-day reset to a healthier you. Click on that, get your 5 days started, and once you've completed it or while you're in the middle of it, come over to our Facebook group and let us know how you're doing. Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey ladies, welcome back to today's episode. I'm so excited to be joined by Dr. NJoy Mena, who is a psychiatrist in the Atlanta, Georgia area. We have been chatting a little bit even just before our recording today, and I know that she has so many great gems and pearls to drop with us today. So, Dr. Mena, I'm actually, if you're okay with it, I'm going to call you Dr. NJoy because that is what
Yeah.
you go by in your practice, right? Tell us a little bit about that and just a little bit about you in general before we start talking.
Yeah. So my name is Dr. Nina Joy Mena. And so affectionately, I go by Dr. Enjoy because, it just sounds really cool. And I am owner of Enjoy Life, living in full empowerment. It's a part-time virtual psychiatric private practice. And I see patients mainly in Georgia, but I have license in 11 states. And I am also chief medical officer of Chris 180. It's a community mental health center where I see patients in the general Atlanta area. And I am a publisher as well of Enjoyno, Nurturing Authentic Living. And it is a wellness journal and therapeutic companion that allows people to balance their mental, physical, financial, aspirational, their dreams, as well as social health. And I'm a podcaster too, such as yourself. I host the Journey to Joy live podcast.
Well, that is awesome. So excited about the podcast and the journal. And I was going to ask you later, but since we're there, if I can ask you now, if you're okay with it, can I link to the journal and the show notes so that if anyone wants to purchase it or just to find out more about you, then they know where they can go?
Yes, please.
Absolutely. Well, we'll be sure to include it in the show notes there for sure. So,
Thank you.
Dr. Enjoy, again, I'm so excited to have you today because I wanted us to talk about something that I know sometimes is an issue for me. And because it's an issue for me, I'm sure that it's an issue for other women as well. And that is just dealing with stress. So, dealing with stress, and sometimes that leads to a little bit of overwhelm or this common term that we hear maybe thrown around, and that's burnout. And so, wanted to chat with you about that. I know that your experience as a psychiatrist psychiatrist, that
Hmm.
certainly you see it in your regular practice, but that you are, keenly aware of how it impacts our physical health. And so the whole
Hmm.
idea of our Headed to Healthier podcast is really to help women who have committed to being healthier, that this is their year. They're going to get
Yes.
healthier for themselves and for the people that they love and who love them. And sometimes stressors come into play and just affect our ability to be able to do the things that we want to do and the things we need to do. Has that been your experience just in treating patients as well?
Oh, yeah. I mean, stress is an everyday thing. You just can't get away from it. There's always going to be challenges, as they say, life be life. And it's just a matter of what kind of coping strategies you're going to do, making sure you keep up with a good daily self-care routine. Sometimes that self-care routine changes as stress increases or as burnout starts to show. But yeah, we're all dealing with it. And I definitely focus a lot on burnout and self-care for sure.
Absolutely. Since you brought it up, let's talk about self-care a little bit. So this
Hmm.
idea of self-care is often discussed, but for busy women, sometimes it can be just one more thing that we have to add to
Oh
a list
gosh.
of
Yeah.
that's already full. So what are your thoughts of just some practical and realistic, even if they're a little bit unconventional, self-care strategies that busy women can incorporate into their lives?
Well, first of all, we have to change our mindset around self-care. Like you said, some people think of it as just like this extra task that I have to do or that you have to do or this extra chore. But, first of all, self-care isn't selfish. So,
Ooh, I
self-care,
like that.
yeah, it's not selfish and it's not a luxury. It's a requirement for you to do self-care because how are you going to be everything to everyone but not prioritize yourself? So you have to put yourself on your to-do list. You have this long to-do list. You need to put yourself first. And, practical strategies could be very small. You don't have to be, oh, I got to take a vacation and get away to the beach. That would be nice, but that's not something you can do every day. So if you're just waiting on that big trip, but yet stressing out every single day, just waiting on that big trip, what's that going to do? So it's in the small moments, the small 5-minute resets that you might take if you're a physician in between patients or in between appointments or calls or meetings. You might go outside and catch some sun just laying on your skin and it feels real good. Or it might be just simply taking a reset and thinking about what you're grateful of. Gratitude goes a long way. I was just talking with someone yesterday and they said, gratitude, a grateful mind and an anxious mind cannot occur at the same time. So
Ooh,
you might
that's
get
good.
anxious, stressed out, but once you start to think about things that you're grateful of, that in and of itself is a mental self-care practice. So self-care isn't always like, what did I do for my body, but it's also what am I doing for my mind? Of course, exercise, good sleep, eating healthy, all those things, taking care of yourself. It has to be a priority the same way everything else you try to put on your priority list.
We talk about stress and we talk about
Hmm.
how stress affects our body and affects us as we go through the day. Some of our listeners may be experiencing symptoms, but aren't sure if this is stress or if they truly are burned out. And like I
Yeah.
said, I feel like, especially lately, we hear a lot about that term burnout. How can we
Hmm.
start to distinguish between or make the distinction between kind of everyday stress and, oh, I've just got a lot on my plate, and then truly feeling burned out?
Well, I guess you can think of it like this. If you have a fire of energy that's getting you through your day, and that fire is literally burnt out and it's not there, you can no longer get through your day. So if you think about the difference between burnout and stress, stress would be, well, the fire's there. Is some wind might be blowing at it, it might be wiggling and all that, but it's still getting some heat out there. It's still giving you energy. You're still able to get through your day to day. There might be something that happens, a bill that needs to get paid unexpectedly, but you get through it. It stresses you for a little bit, but you get through it. True full burnout, that fire's not there, like I said. You don't have the energy to do certain things. Things are different now. You're not able to sleep or you're sleeping too much. You're not able to, maybe you're not eating. Maybe eating changes and you need a break. You feel like you just can't even go on. Stress doesn't make you feel like you can't go on, but burnout, you
Right.
feel like you can't go on. And of course, now you're transitioning into a clinical diagnosis because burnout isn't necessarily a clinical diagnosis. But if you continue to go on with that fire is out and not taking care of yourself, then you go into true, full clinical depression or anxiety where you really aren't able to do work. Relationships are faulting. You're definitely not eating. Maybe suicidal thoughts are coming because you definitely didn't take care of yourself and I'm having a clinical depression, or you are turning to alcohol or turning to drugs and things like that to self-diagnose. So I went kind of far there, going all the way to depression, but
No, I
that's
love
pretty much
that.
the
Yeah.
gradient. Yeah, the stress, then burnout, then clinical depression or anxiety.
Right. And I love that you went there. I was kind of thinking of what we would talk about today. And in that same discussion of burnout, I wanted to talk about some of those long-term consequences and what happens when we get a little bit further down that road. And I think you've already began that discussion. So,
Yes.
depression, full-on depression, significant anxiety,
Mm-hmm.
even suicidal thoughts
Mm-hmm.
or ideations. And that is why we have this discussion, right? So that is why we start to have the discussion about when is this just quote unquote stress or when is this true burnout and we need to do something about it. And so I think you've made that point as to kind of when it becomes met that tipping point
Problem.
and need to address it. How should women go about addressing that? If someone's listening now and they feel like, okay, the fire is not there, what would you say are next steps for those women?
Definitely. If you actually recognize that you're going through burnout and you aren't able to get things done like you used to, that's a sign that extra support is needed, right? And it is okay. It's okay to not be okay, but it's not okay to stay not okay. How about that? Take care of yourself. So,
Right.
what does support mean? Maybe you don't have a therapist or you don't know what psychiatrists reach out to. Reach out to your primary care doc who can tell you what the resources are, but a therapist can help you through this journey, can help you figure out, well, how can you do time management, learn how to delegate, learn how to prioritize yourself so that you are getting the self-care that you need, and also help you deal with depression or stressors. Maybe there's some trauma that from back in the day, some chronic stressors that's coming up and resurfacing because of the stressor that is leading to your burnout. That therapy can help. And if therapy alone doesn't help, the less than therapy techniques, it's all right that maybe you need a medication. That is okay. And that's where a psychiatrist comes in hand.
Right. So let's push that a little bit more then, because in my private practice, I'm primary care, so I'm family doc, and I see patients
Right.
all throughout the day, and we talk about stress, we talk about clinical diagnoses of anxiety or depression, and I still feel like, and maybe you see this in your practice too, there's still so much stigma that is attached to
Mm-hmm.
medications and treating true
Yeah.
psychiatric conditions. And so, would you talk just with us a little bit more about that, kind of how you see that and maybe even how you bring that up with
Mm-hmm.
folks in clinic to let them know that medicines are okay and sometimes we actually need them.
Yeah. And I know my patients trust me because I'm definitely not trying to throw a pill at them when I first see them, right? So especially
Right,
if they haven't
right.
been on one, I'm giving them all kinds of therapeutic strategies, if spiritual strategies, physical strategies, exercise, dance, whatever it is that it takes. We try all kinds of things and even alternative methods such as fish oil, natural methods, and things like that. So, when those things don't work or, maybe they do walk in the door with severe suicidal thoughts and things like that, then that's when I'll start with the medication. So it might be that the less than therapy strategies didn't work. And that's when I would say, let's do medication. Or if, like I said, they have more severe symptoms. But most people are afraid because they're just like, will I be on this medication for the rest of my life? Will it change my personality?
So I feel like that is the question I'm asked most often. Will I be on this medication forever?
Exactly. Well, no. No. For most part, for most people, especially for depression, especially for anxiety too. Maybe you need the medication for a few months to a year to get you through what you're going through and to get you to fill your therapeutic toolbox. So you're not going to be on a medication and that's it. You're going to therapy so you can fill up your therapeutic
Right.
toolbox and learn the strategies. And I say a few months to a year because research says that you got to be on the medication for at least a year doing well, because if you get off of it in less than a year before doing well, then that increases your risk of relapse. So we don't want that. So once you get on it, it's nice, it's good for you to be on it for a year. There are situations where maybe you get off of it before that, but it doesn't mean you can never, get off of it. And as far as changing your personality, no, it doesn't. I know some people feel like they would like a family member to be on it to change their personality, but
Right.
nah, we can't change your
Right.
personality.
Right. I feel like I get that sometimes. I'll have, wives come with their husbands or, with siblings come together and it's like, Dr. Anderson, do you have something to change them? And that's not what it's about, right? It's not about changing a person altogether, but it is about
Yeah.
helping them get to a better space, right? A better space that
Hmm.
they're able to function in society and do the things that they need to do.
Exactly. And for the people who would need to be on a medication for the rest of your life, we're talking about people with psychosis, schizophrenia, bipolar. Those are the people that typically need to be on a medication for the rest of their life. But even then, there are some people that I know with schizoaffective disorder and bipolar who aren't on medication and doing just fine, but that is rare. So obviously, we're talking about burnout. So we're talking about patients who may have clinical depression and anxiety.
Absolutely. And I think you mentioned it a little bit before, but if I missed it, what is that line between, okay, I'm seeing a therapist and I'm getting therapy, having counseling sessions, et cetera, versus, okay, I need to talk to my primary care doctor or talk to my therapist about seeing a psychiatrist? Where do you find that line for people?
I mean, there's no real line. If you can just go straight to a psychiatrist and they can give you that initial diagnostic assessment and figure it out. Just because you come and see me doesn't mean you have to get on a medication. So, I have a
Absolutely.
lot of patients I see for just therapy and that's it. I don't give any medication. But in case there is an answer to that question, it's really when therapy is just not cutting it. Therapy is not working and things are staying the same. Nothing's changing. You're still not sleeping well. You're still turning to wine at night and drinking a whole bottle of wine and still not able to get some sleep. You still have those suicidal thoughts, or you still are struggling to get through your workday and you need to take a leave, right? Therapy is not helping, then that is that line, that obvious line where, hey, let's see a psychiatrist. Some primary care docs, not some, most primary care docs, treat ADHD, depression, anxiety. It really, from a primary care doc standpoint, it really just depends on their comfort level, right? If you feel like
Hmm. Hmm.
it just becomes a little bit more complex, then you call your psychiatrist friend and say, hey, take this patient.
Absolutely, absolutely. And in some places, so our area, I mean, we're short on psychiatrists, having them there
Exactly.
locally, which is why exactly. And so I do in my own practice do a good bit of treatment myself. But I love where we started this discussion, and that was that you do virtual psychiatry, right? And you
Yes.
do some virtual therapy. Also, will you tell us just a little bit about that, how it looks, if maybe our listeners are not familiar with telemedicine or virtual care at all? What does that look like in the psychiatric setting?
Yeah, so it's on Zoom. It's confidential platform, and there's no reason to believe that there's anybody listening or it's not recorded and things like that. And I'm in my private home office, and patients are in their home, right? So I don't allow you to be driving. I've had patients, of course, in the middle of their workday. They go to their
Mhm.
car. No one else is there. They sit there and have their appointment on their phone, and that is perfectly fine. But not driving. The idea is that not in a public place in Starbucks or something doing your appointment, but it's completely private, and we're able to see each other's faces. So it's not audio; it's definitely video. So that's how a telepsych consult or appointment is.
I think for places where there is a shortage of psychiatrists, I think that is perfect. Or even at times when that is just what's most convenient, right? And so,
Mm-hmm.
like you said, instead of someone having to get in their car and drive to the psychiatry office for their visit, they can,
Mm-hmm.
do it closed off in their office or can be in their car. And so,
Yeah,
I do really think that it certainly is convenient for patients and
for
people in
sure.
general, and certainly is helpful too. Any other thoughts that you have just on burnout in general? Anything that you have seen clinically that you wanted to share, or something that listeners should be kind of mindful of if they are thinking, all right, have I pushed it past kind of general run of the mill stress, and this is something more than that. This is true burnout.
Yeah, I mean, I really want to keep pushing the whole self-care routine, knowing what it is that brings you 0 to 100, not to anger, but 0 to 100 from stress to joy, because that is very important. For instance, mine is running. Running does it for me every time. If I do my little 5K, 30 minutes on the treadmill, I am good. So if I start experiencing some stress, it could be even just a few days ago. It was 11:30 at night and I couldn't sleep. And what did I do? I went downstairs and got on my treadmill and I felt so fine. My anxious thoughts just melted away. And sometimes you have to adjust your self care routine. So maybe
Hmm.
you exercise every day, you're doing all the things, but if a major stressors come and you are just like, oh, this is just not cutting it, what is that next level self care routine that you need? Maybe it is taking a wellness day. Maybe it is taking a girls' trip and going to do something. Or maybe it is having an extra visit with your therapist that week. So it's definitely very important to just the way you maintain the health of your car every so often. You just have to keep that maintenance routine and doing something for yourself every single day is very key to your health and preventing burnout.
Absolutely. And I love how when we started, you said self care is not selfish. And that's what so many
Mm-hmm.
people, myself included, at times have thought of it in that way. And so I think that is something really important to keep in mind. Now, I want to get into this journal. So it is called
Yay.
NJoy. Is that right?
Yes.
So tell us
Yes.
about it. How is it set up? Just what made you want to do the journal, your general thoughts on journaling as a means of kind of getting rid
Mm.
of some of that stress and relieving stress. Just tell us about it.
Right. It's called an NJournal because it's not your typical journal. It's a wellness journal and therapeutic companion, which means that, if you had a therapist, you can definitely work through it with your therapist. If you didn't have a therapist, you could definitely still work through it. And it is set up kind of like in 11 weeks. If you did it beginning to end, it takes 11 weeks, but you can do it as slow as you wish or as fast as you wish. And you can start wherever you want. And it introduces the Inspire Joy method, INSPIRE, which stands for integrity, nurture, stability, purpose, intimacy, resilience, and empowerment. And that pretty much covers the five crucial areas of health that I mentioned: mental, physical, financial, aspirational, and social. And then the R and E, resilience and empowerment, because you really need the resilience to get through challenges and stress and trauma. And you need empowerment to be able to be your true self, to live authentically. And actually, the way the title is the Enjoy No, the NAL is capitalized because that stands for nurturing authentic living. So it
I
really
love
boils
that.
down to, and really truly having joy is living authentically and being yourself, as they say, unapologetically, and being able to practice those boundaries and say no. And I got to do this for me and be
Right,
assertive and
right.
be okay with it. So it's awesome because it has 100 positive affirmations, therapeutic strategies, self-care tips. There's therapeutic strategies such as CBT, cognitive behavioral therapy, DBT, dialectical behavioral therapy, as well as positive psychology and mindfulness-based strategies. So the point is really to bring the therapeutic strategies to the communities who's just like avoids therapy. If they pick up this journal, they will get some therapeutic strategies and really work through past traumas and learn how to cultivate gratitude and positive emotions and thoughts.
Absolutely. It sounds amazing. You brought up affirmations. Tell me just, or tell us just kind of quickly your thoughts on affirmations, the importance of affirmations, how often we should do it through the day. Just where are your thoughts there?
I prescribe positive affirmations all the time, along with exercise. Exercise and positive affirmations, I prescribe all the time. Anyhow, so it's very important because guess what? Bad thoughts and negative thoughts work. They make you feel
Yes.
bad.
Yeah.
And positive thoughts work too. They make you feel good. And when you get caught in stress, burnout, it's so easy to be irritable. It's so easy to be self critical. You just turn into your largest self bully. And it's really important, along with the gratitude I mentioned early, to think positively, to say, I can do this. I am awesome. I'm beautiful. I'm strong. I'm handsome. I'm brave. Whatever it is you need to say that's positive. And lately, I've discovered that one of my deep seated automatic negative thoughts are I didn't do enough or I am not enough. Ooh, if I am thinking about that, or my husband might say something that kind of activates that I am enough thought, I'm not enough thought, then that just my day, my sensitivity level just
Mhm.
goes completely down. And then when I recognize it, oh, I'm having that thought that's not true. And so I
Right.
correct it and I say, I am enough. Like, how different does that make you feel when you say, I am enough? And here I am, a psychiatrist. So we all go through this stuff,
Right.
right?
Absolutely.
So
Absolutely.
that is so important. Positive affirmations. It sounds fluffy, like, oh, how dare you just tell me to think happy? that's just one of the million things that help.
Right, absolutely. Well, I love that. Certainly something that we can all easily incorporate into our day, right? It's
Yeah.
nothing that we I love that you call it a prescription. It is the easiest prescription. You don't have to go to the pharmacy and pick it up. It costs you nothing monetarily. It's something that you can absolutely do on your own. And
Yeah,
so
and you asked how often. I mean, really, like you said, throughout the day, at least 3 times a day. And there's apps out there. There's an app called I Am, which I actually have on my phone. It gives me an affirmation every hour, so you can set the frequency if you wish. So there's
okay,
apps that
I've
can
never
help.
heard of that. Yeah, tell me the
Yeah,
name of that app one more
it's
time, you
called
said.
I Am.
Okay, I'll link that in the
Yeah,
show notes too. What
yeah. And
other
there's
things
another
have
one called
go ahead.
Think Up, and it helps you. Basically, you can record your own voice. So some people like hearing their own voice tell them positive things.
Yeah, I think that is what I would like. That is
Look at that.
wonderful. I'm gonna, yeah. So think up and I am. So, ladies, don't worry. You don't have to write those down. I'm gonna link them in the show notes. So I'm linking those things. I'm linking the Enjoy Null Nurturing Authentic Living Journal that Dr. Enjoy has created. Anything else that I should link? Your podcast. Tell us a little bit about your podcast.
Yes, Journey to Joy Live. So I go live every Thursday at 7 from all of my platforms, and I'm also on all the podcast platforms. I started it in July 2023 during Minority Mental Health Awareness Month because I said, you know what? I want to do something different. I see other therapists out there going live and doing podcasts and things like that. And I just want to help reduce the stigma of mental illness in the Black community, get us going to therapy, get us talking about whatever it is that we need to talk about as far as our mental health. So I haven't stopped every week. I got episode 95 coming up next week, and we talk about
95.
various
Wow.
topics. Journey to joy. You can talk about anything. We've talked about sex and self-care, ADHD, parenting stress, relationship issues, how to unlearn the I have to do it all mentality. There's various topics.
Well, absolutely. And so I'm encouraging everyone to go find your Journey to Joy podcast, subscribe to the podcast, make sure that you leave a review for Dr. Enjoy
Thank you,
also on her
please.
podcast. Reviews are the way that others can find us when we are doing our podcast search. So love
Hmm.
that. Anything else that you want our listeners to know? I know that you're super busy, so I won't hold you too long, but anything else that you wanted to share? I've loved having you with me today.
Appreciate you. Thank you so much. Well, I am working on the next book called Inspire Joy for the Wife, Mom, Boss.
Oh,
Balance
that
how to
sounds great.
balance it all without losing yourself. So that should be coming out next month.
Well, I love that. I'm not yet a wife or a mom, but I am a boss. And so that
Hey.
sounds and so that sounds wonderful. And so when you have that, let us know. I'll go back and I mean you're gonna have all the links, Dr. Enjoy,
Oh,
all the
thank
links on the show
you.
notes. So when you get that done, please let us know so that future listeners can find it when they listen to this episode. And current listeners just know that in about a month or so, you can go back and look for that one and it'll be plugged into. Well, again, it has been wonderful talking with you today. Even just our chat
Thank you.
before actually starting the recording was so inspiring to me. You certainly live up to your name. You were
Oh.
given the perfect name in Joy. So, Dr. Nina Joy Mena, thank you so much for being on the Headed to Healthier podcast today. I've appreciated having you.
Thank you for having me. Appreciate it.
All right, ladies. Well, if you have not yet subscribed to the Headed to Healthier podcast, please be sure to do that. Also, make sure that you leave a review and also share it with a friend. If you've heard anything on this episode or previous episodes that you know of another woman who would benefit from hearing it, please do share it with her because we are all headed to healthier and we're doing it together. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.